Should you feel guilty about struggling with your mental health? It's a question I get asked a lot from clients of mine and people who will private message me on social media. They'll say something along the lines of, I've been struggling with my mental health for a while. I've had this challenge and this challenge and this challenge come up. And I feel really embarrassed about it. I feel guilty. I feel ashamed. I feel like having this thing is going to ruin my life. Should I be feeling this way? Is there actually something wrong with me? What I'm going to dive into in this video are 5 myths about mental health that you've probably thought of at one time. You've probably heard somebody else say, and the truth of the matter is, if you or someone you know is experiencing these, it's probably harming your life in more ways than you can count and in more ways than you can comprehend. So, what I'm going to dive into are the 5 myths that you are probably getting sucked into and a way to reframe them so that you are not struggling with these ideas anymore. So, number one, mental illness is a moral failure from being emotionally weak. There's been this narrative that's been going on for a really long time that mental illness comes as a result of just being a weak, broken human being, that if you were stronger, you wouldn't struggle with these issues. And that is something to be ashamed of. It's this moral ineptitude that you have that now you should feel bad about and go hide in the corner or go enter yourself into a mental institution and be kept away from society. It's really ridiculous. And if we really think about it, would we ever say that about somebody who's struggling with a medical diagnosis? If someone came to you and said, "Hey, I have diabetes, type 1 diabetes, not type 2, I have type 1 diabetes," or, "I just found out that I have Crohn's disease, or I have IBS, or I have this, or I have that." Would you look them in the face and be like, "Honestly, you're just weak and you're really broken. And in all honesty, we're going to shun you and we're going to put you in the corner over there"? Obviously not. But we do that when it comes to mental health. We say, "I have depression. I'm struggling with anxiety. I have PTSD. I'm having some of these OCD type behaviors. It must be because I'm such a weak human being. That's why this happened to me. And because of that, I'm not going to tell anybody and I'm going to suffer in silence." It's not true. Mental illness doesn't come from you being weak. Mental illness comes from the circumstances in your life that you probably didn't have control over. When we feel depressed, when we feel anxious, when we are struggling with whatever, it usually comes down to a few things. Number one, the people in your life, people that were supposed to help you and raise you and whatever, didn't actually give you the skills that you needed in order to function the way that you believe you were supposed to. Number two, you were never given the skills to navigate difficulty. And number three, life happens and we all struggle. So life happens, you don't have number one and two, so you're struggling like any normal human being would. But somehow that makes you weak. Somehow that makes you a failure. Somehow that means that you're just inept. The truth is, you never developed the skills in order to navigate the challenges that you're having in your life. Or something so terrible happened to you that you didn't know how to handle and cope with, and so you're experiencing these challenges. So, mental illness is a moral failure from being emotionally weak. Number one, it is an absolute myth. And the thing that you need to remind yourself is that I'm not weak. I'm not having these challenges because I'm weak. I'm having these challenges because Circumstances happened, and for whatever reason, I didn't have the tools to handle them and cope with them. So I am struggling. And you know what's really cool about that? It means you can go get the skills. It means you can go talk to somebody like a therapist who knows a little bit better than you, who can give you the tools and the skills to be able to learn better, do better, and be better. Number two, mental illness only happens if something tragic happens to you. This is also a radical myth. The amount of people that I have talked to in my personal life and working as a therapist for 6 years who have said, I'm really struggling, but I didn't go to war, or I wasn't violently assaulted, or some horrific thing didn't happen to me. So why am I struggling? I didn't have it that bad. This something horrible, didn't bestow upon me. So tying back into number one, it must just be because I'm weak and I'm broken. Mental illness, again, is not about what happens to you. This is what people fail to understand, and this is why there is so much stigma around mental health. Mental health and mental illness is not about what happens to you. There's three really big factors that dive into mental health. Number one is biological factors, meaning for whatever reason, you were given a specific genetic makeup that you didn't have any control over. Number two is psychological factors, meaning things happened in your life that got internalized in a certain way, mixed with your biology, that caused you to think and feel and behave and perceive yourself, others in the world in a certain way. And number three, social factors. Who were you surrounded with? What were the lessons that you learned? Who were your models? What did you see them doing? These are the things that contribute to your struggles and mental illness, not some horrific thing happening to you. And yes, that is a part of it, but it's not the whole equation. More often than not, mental health happens because of those three factors ending up in just the perfect storm that cause us to struggle. So if you have found yourself saying, well, something terrible didn't happen to me, so why am I struggling? The thing that you need to tell yourself is something terrible doesn't have to happen for me in order for me to struggle. I am a human being and life happened the way that it did, and I'm having a hard time because of it. And again, that also ties into the point that I made in number one, which was the cool thing about that is you can go develop skills. You can go talk to somebody who can help you to understand the real deeper reasons why you're struggling and then actually be able to do something about it. But if you're just bombarding yourself with this message that I shouldn't be struggling, why am I struggling? Oh my God, there's something wrong with me. How are you supposed to feel better? How are you ever supposed to get better and do better if you're just shaming yourself for the fact that you're having a hard time? How is that going to help you have a really beautiful life? It's not. It won't work. And you've probably been so cruel and so mean to yourself as a result of these messages that you've been trying to tell yourself that you're just weak and that you just can't handle life. It's not true. It's not true. And that's where therapy can really help. But this is also where number three comes in. Standard talk therapy cures mental illness and is enough. Standard talk therapy can be effective for some people. You go to a therapist, you kind of shoot the shit, you tell them what's going on. They just sit there and listen to you and validate your experiences, and then you leave. For some people, that's awesome. Some people, that's all they need. They just need someone to sit there and listen, and that's enough. But for the majority of other people, just sitting there and talking to somebody and having that person ask how that made you feel, and then getting, you know, gentle, subtle validation, or just knowing that there's somebody else there, that's not enough, because a lot of people have deeper things that are going on that just shooting the shit with a professional isn't going to fix, isn't going to resolve. And this is why a lot of people don't want to go to therapy, because they say, why am I just going to sit there and tell somebody my problems and then leave? It doesn't change anything. I actually did a pre call with someone a couple of weeks ago, and they were really, really struggling with the idea of therapy. They were like, how are you even going to be able to help me? I've been struggling for years. Me just sitting here and telling you my deep, dark secrets isn't going to change anything. And I validated him. I'm like, you're 10 out of 10 right. Me just sitting here and listening, it's not going to change anything. It won't. You know what will? Us unpacking what happened and why and how you got here, and then making a plan to move forward. Real effective therapy, whether you use CBT, IFS, DBT, any of the other evidence-based models, which I did a video on previously about how to know you're having good therapy. It doesn't matter what model you're using. What matters is it effective for you? Just like a diet, right? Every diet works. It's just a matter of which one are you going to be consistent with. And therapy is the exact same thing. Regardless of the method you use, regardless of the model, what matters is, are you doing the necessary steps to make meaningful and effective change in the right direction? That, and that alone, is how you are going to have really good outcomes in therapy. And yes, for some people, just sitting there and talking is enough. And I really, really love that. I love that that works for some people. But for the other people who's like, that fucking sounds awful, there are other methods. There are other things that you can do. There's other models that you can utilize. And there are steps you can take forward. Number 4, everyone has mental illness. Yes, kind of. But the challenge with that is we are misusing the words, and it's invalidating so many people's experiences. Depression, anxiety, narcissist, codependent, avoidant, autistic. There's so many words that have just been thrown around. Traumatized, triggered. I actually did a post on Threads like a couple of months ago, I want to say now, where I said all of the mental health words that are overly misused and they're being wrongly used. It blew up. It was fascinating. It was so cool. But these words are radically being overused and misused, and it's minimizing and invalidating the experiences for the people who are actually struggling with these. Just because you're feeling sad doesn't mean you're depressed. Just because you're having racing thoughts doesn't mean you have anxiety. Just because you're orderly doesn't mean you have obsessive compulsive disorder. And just because something bothers you doesn't mean that it's a trigger. We're misusing these words, and it's making it so that they have no meaning anymore. If I called everything a can, this wouldn't be a can anymore. If this was a can, and this was a can, and this was a can, what would actually be a can? How would you know if it was actually a can versus a phone or headphones? And I know that's a stupid ass example, but it kind of goes perfectly with this. We're using these words and we're using them incorrectly, so they lose their value. They lose their purpose. I think people really struggle with the idea of struggling to the first 2 points. So, unless you can have a diagnosis and say that there's something wrong with you, then we feel ashamed that we're having a hard time. Kind of on the other end of the spectrum, it's like if I don't have a diagnosis, then that means I'm weak too. I've actually had a client say that. He said, I need you to give me a diagnosis because I can't just have it be that I'm just weak. It needs to be that there is something wrong with me so that it's not just because of me. And I think a lot of people are struggling with this. I think a lot of people, and from what I've seen in my therapy practice, we really can't stand the idea that we're not competent or that we're not enough or that we don't have certain skills to help us get by. But you don't need a label, and you don't need the wrong label in order for your struggles to be valid. If you're having racing thoughts, say you're having racing thoughts. If you're feeling sad, say you're sad. And if the people around you are judging you for it, then maybe you're surrounded with the wrong people. Maybe you're not surrounded with emotionally intelligent people who actually understand, that we're all human and that we all struggle, because we do. We are all human. We all struggle, and that's okay. I struggle all the time, and I do have a mental illness. I do have a diagnosed mental illness, but it doesn't define me. And I don't blame all of my challenges on it. I've done the work to overcome it, but I don't blame it on everything. If I'm angry, I say it's because I'm angry. If I'm having a bad day, I'll say I'm having a bad day. If I'm feeling sad, I'll say I'm feeling sad. But when we overuse these words, they are losing their essence. And then the people who really are struggling with them feel like they can't say it because everybody's depressed, which makes a lot of sense and it is really invalidating. You can have struggles and you can have challenges without it needing to be a diagnosis. This dives into the last one, and this brings us to the last one. If you've stuck around so far, super grateful. I really think this one is one of the biggest ones, and honestly, one of the biggest ones that is hurting so many people from getting the help that they need. And I've seen it time and time again. The fifth myth is that mental illnesses go away with medication. Now, full disclaimer, I am not anti psychiatric medication, right? I'm not against it. I would never tell somebody not to use it, but we are relying on it. Just like people are relying on Ozempic for weight loss. A tool is a medication is a tool, and all tools are effective if they are used appropriately. If you struggled with PTSD and your provider gives you a pill to help you not feel depressed anymore and to help you not have nightmares, that is a beautiful thing. But that isn't going to take away why you're feeling depressed and why the nightmares are there. If you have depression and your psychiatrist or your provider gives you an antidepressant, that is a beautiful thing. But it's not going to take away the reason why you have depression, why you're struggling with depression. It dampens the emotional intensity of the symptoms a little bit, but it doesn't take it away. And there have been countless studies that have been done that demonstrate that these medications do not work the way that we are craving and so deeply needing for them to work. And I think all of the rest of these, numbers 1, 2, 3, and 4, are why we are so reliant on medication, because we're afraid to do the work. We're afraid that there's something wrong with us. We're afraid that something terrible didn't happen to me, so I need this drug to make it better. We're so ashamed of struggling. And we're so ashamed of the fact that we need to do something to make it better. So we're relying on these drugs to fix it. And the truth of the matter is, it's not going to fix it. It's not going to make your struggles go away. If you are having a purely biological mental health crisis, then yeah. If you're experiencing like a psychotic episode that was induced by, I don't know, like a neurological deficit or a defect, then yeah, a medication will probably help. But if you're struggling with depression because you and your partner broke up and you can't get out of bed, a medication is not going to fix the feelings of worthlessness that you are feeling because you were rejected and now you're going to die alone. It's not going to make that go away. It's not going to make the script that you have in your mind go away. Therapy will. Therapy is scary for a lot of people. And acknowledging that you're struggling is so terrifying for so many people. But if you actually want the life of your dreams, if you actually want to be happy, if you actually want to love yourself, then you have to take the right steps. You have to be willing to do the things that get you that life. And I know it's hard. I know we don't want to have to work for it. I didn't want to. I didn't want to go to therapy. I didn't want to do coaching. I didn't want to look at all of my mistakes. I didn't want to acknowledge I was struggling. That's the only thing that actually changed my life. And I guarantee it'll change yours too. So, just to recap, number one, mental illness is not a moral failure because you're weak. Mental illness does not only happen if something horrific happened to you. Number three, standard talk therapy does not cure everything. You need an evidence-based treatment. Number four, not everything is depression. Not everything is a trigger. Not everything is, trauma. And that's okay. That doesn't mean that you're not struggling, but we need to use the words correctly. And number five, medication is not going to take all of your pain away. Brutal truths. Truths hurt, but they liberate us to actually get the help that we need and to make the life that we truly want. And I guarantee if you take this video to heart and if you take the real appropriate steps, your life will change significantly. Drop a comment down below. Let me know which of these resonated the most with you, which one you've heard from other people, which one that you've struggled with the most. If you need help navigating these things, I am actively taking clients. You could put a comment down below or you can DM me. And I'm super excited to hear from you. And I will see you next time.